nobody. She used to be my very own.
This rhyme grown and on. Okay. 23 till the hour. Please welcome the Imus Radio program from Hackensack Meridian Health, the co-CEOs of that organization, Bob Garrett and John Lloyd. Good morning, guys.
Good morning, Don. How you doing?
I'm fine. How are you?
Oh, we're doing great. Hey, what a great day. We're on Imus in the morning, and we're getting a new governor in the state of New Jersey. How about that?
Well, been raising the taxes on the millionaires and legalizing dope. I don't know about all that.
I don't know either. We'll see.
Anyway, let me start with you, Mr. Garrett. How does the co-CEO thing work out?
It's working out. It's working out well. So John and I are co-CEOs for 2.5 years, and when the merger was contemplated, both our boards felt strongly that they wanted their CEO to be the CEO of the new entity. So we worked out an arrangement where for 2.5 years we're going to be co-CEOs, and then John was planning to retire after the 2.5 years, and then it'd be from that point it's the plan for me to become the sole CEO. But honestly, it could not have worked out better. We have different strengths. We complement each other, I think, really nicely. It is unique. The textbooks will tell you co-CEOs, they'll kill each other. It won't work. But in our case, it really has. It's been a good experience.
How long has it been now?
It's been 1.5 years. We're 19 months into it, so we have, I think, another 11 months or so.
Yeah, Don, just to add to that, as Bob said, we've known each other for about 30 years. We both were in New Jersey, and we both respected each other. It's really worked much better than we anticipated. As Bob said, we have different strengths, and that's one of the most important things. And also, we respect each other. So it's really worked well. From time to time, we go behind closed doors and always resolve it. So believe it or not, it works really well.
One of the nicer people, not to patronize him, but one of the nicer people I've ever met in my life is Bob Garrett, for a lot of reasons, personal and professional.
Thank you.
Absolutely. I agree with you 100%.
So now, you're not the John Lloyd who was married to Chris Everett, were you?
No, but, I was a tennis player, but no, I was not married to Chris.
Were you any good?
I was average, but a lot of fun.
Did you play professionally?
Not at all. No.
Oh, okay. So what's going on at Hackensack Meridian Health? Start with you, John.
Well, just a lot of things are very, very exciting. I think most recently we announced the merger with JFK in Edison. That's a great addition to our network. We now have 16 hospitals in the network. And, a lot of people say, well, why are you getting larger? And it's really not about being larger. It's really about having access for our patients to access our services. And so right now we're in about 7 or 8 counties in New Jersey, and we're able to have great coverage.
I have a fairly dumb question, Bob, but what does it mean to me as a patient that Hackensack, for example, is affiliated with all these other, is merged with all these other hospitals?
Well, what it means to patients in our area is better access to quality care, because we now have 16 hospitals. So what we're trying to do is make sure all of our hospitals are at the highest level of quality. And as you know, Don, Hackensack University Medical Center has been number one for many, many years, ranked by different organizations. So there's a great deal of sharing best practices. In addition to that, we're in over 160 ambulatory locations throughout New Jersey, and we directly serve 2/3 of the population of New Jersey. So you could access quality care, whether you're an inpatient in a hospital or in an ambulatory surgery center or an urgent care center or in one of our nursing homes. So it really means being comprehensive and providing the best access to care. So patients really do benefit from a merged system like Hackensack Meridian Health.
Don, if I could add to that, back in the late 80s, after becoming the CEO of Jersey Shore University Medical Center, I wondered why we made patients travel to our hospitals for ambulatory services, and it just made no sense to me. So in the late 80s and early 90s, we started to build what we call our continuum of care, and these are all the ambulatory facilities that are out in the market. These are not physicians' offices, but ambulatory facilities, and it's worked out really, really well.
What do you mean by ambulatory facility?
Well, they would be things like convenient care, urgent care, home care, surgery centers, rehab. Those are just to name a few. And one that we're very proud of is the Health Village at Jackson in Monmouth and Ocean County. That's actually in Ocean County, and that is a 150,000 square foot facility, one-stop shopping for all your healthcare needs.
And Don, the fact of the matter is that more and more healthcare is being provided outside the four walls of hospitals. So having a vast ambulatory care network like Hackensack Meridian is really important for us to provide the full array of services to the patients we serve.
Talking with Robert Garrett and John Lloyd, co-CEOs of Hackensack Meridian Health, about their recent expansion, and that's with JFK, right?
Yes.
Yes.
So JFK is located centrally in New Jersey, and it really links the northern part of our network with the southern part of our network, and it also adds the 16th hospital to our network. And JFK is really well known for their academics, but they're also well known for neurosciences and rehabilitation medicine. So for a lot of reasons, it made great sense for us to add JFK to the to our health network.
And
Go ahead, John.
Oh, yes, I'd like to give a big shout out to Ray Fredericks. He's the president there. I've known him for close to 30 years. We've had a couple of joint ventures with him. It's a phenomenal organization. The culture there is all about patient care, and that's what we're all about as well. So
if you're a patient and something happens to you, how do you know where to go? I mean, what's got me to think, what prompted that question is these various ambulatory facilities now.
Right. So,
what do you do?
So you have different options. A lot of patients still have primary care physicians, and they'll help to direct patients where to go. We have a clinically integrated network now of over 3,000 physicians that are a part of it. And in total, there's over 6,500 physicians affiliated with Hackensack Meridian. But in addition to that, if you access a healthcare systems website, there's really directions in terms of where, to really access our system, whether it's at an ambulatory surgery center, an urgent care center, or if it's something serious, we still obviously want people to come into the emergency room if they're not quite sure what level of care they need. But there are great options now, and especially young people, more and more are using these ambulatory care facilities. More and more are using what they call telehealth. So they have like virtual health visits with physicians. It's just giving patients and consumers more options for healthcare.
How's the mess that health insurance for most individuals is, Obamacare and so on, affected just the ability for people to come to one of your facilities?
It's John. One of the things I've said from day one, even when Obamacare came into existence, that if I were in charge, I would have done two things. Number one is I would have provided coverage for every resident in this country, which I think we should do anyway. And that's very, very important. And the second thing I would have done is I would have kept it simple. And they make it too complicated. I would have done a phase 1, phase 2. But right now, it's a mess in Washington. We're very concerned about our patients not being able to get coverage, and we'll just have to see what else we can do to sort of advocate for them.
Yeah, and Don, in New Jersey, it's no different than a lot of other states. So on the healthcare insurance exchange, we've lost a lot of insurance options. So consumers, patients don't have as many options. And the other thing we're really concerned about is when the Affordable Care Act was put in place, it expanded Medicaid greatly, and in New Jersey, we were one of the Medicaid expansion states. If that were to be revoked, patients would be uninsured, and they would end off, unfortunately, in our emergency rooms, sometimes where they're not needed to be. So it's really a big issue, and we've been really advocating, for reform of the Affordable Care Act, but not to necessarily throw out the baby with the bathwater.
But how have you been coping in the meantime, kind of as
Yeah, I mean,
sort of my original question.
Yeah, we've been doing okay. And what we do, we have a service at Hackensack Meridian where we help people find insurance plans. So people can call our offices, our billing offices, and our insurance offices, and they can be assisted in trying to enroll either in Medicaid or in other private insurance plans. So we've been coping, but the uncertainty of not knowing, what's going to happen with the Affordable Care Act, what's going to happen to the Medicaid expansion, really makes it difficult to plan for the future.
Don, just to add to that, we take every patient who comes to our facilities, and that's our commitment as a not-for-profit, and we take care of every patient who comes to us.
I'd like to take this opportunity, by the way, to thank you for your sponsorship of Stage 17 there at the radio station, sponsored by Hackensack Meridian Health.
We just got a little tour of it, and I'll tell you what, there's more branding and logos here than there are at our hospitals, Don.
Well, we have a very energetic, enthusiastic, proactive sales staff. So
Absolutely.
well, congratulations to both of you. I had visions of before you became on this morning. We're trying to drive a wedge between the two of you so that we'd have a Texas Chainsaw death match. But it sounded like a really a wonderfully working relationship with both of you, if I can get it out. And of course, the expansion of Hackensack has been something to watch. I've been just sitting here watching it for the past, I guess 40 years.
Yeah.
Really a remarkable job. Going back to John Ferguson and now you guys. And so congratulations. And
thank you, Don. And thank you for all your support for many, many years. And, as I think a lot of your listeners know, Deirdre Imus is still very involved in the Environmental Health Center. And I just had a conference call with her a few weeks ago. We're going to focus on a whole new initiative with environmental health research. So she's been a great advocate, and we really appreciate both of your support.
I see her she's on the phone every single day.
Yeah.
With the people at her center running ads. So,
Don, I want to congratulate you and Deirdre, and to Deirdre, go Villanova. my son is there now.
Oh, okay. All right. Well, thanks, you guys.
Thank you very much.
Robert Garrett and John Lloyd, co-CEOs of Hackensack Meridian Health. Battle of the Bands coming up. Nearly 10 minutes down till the hour.